I'm Madeline. I'm an occupational therapist here at Children's Hospital, and I work on the inpatient side. So I work in our pediatric intensive care unit and on our general surgery floors. We also have occupational therapists that work in our outpatient department, so they kind of do some similar treatments there. We also have a certified hand therapist here. We have OTs that work in the NICU. We kind of have OTs all over the hospital. So an occupational therapist is a rehab specialist that works with kids, and our main goal is kind of helping kids gain or regain independence in their everyday activities or their occupations. So an occupation is anything you do during the day. So that could include getting dressed in the morning, making breakfast, writing your assignments at school, playing a sport. All the components of those activities are things we work on. Our biggest goal is to help a child either gain or regain their independence, so they can have some autonomy over what they, want to do and be able to do, whether that's, playing a sport or just being able to put their shirt on by themselves. I really love that OT is so client and family centered, so we work with the families very closely. What's important to you? What do you want your child to be able to do? Or to ask the child, what is going to make your life easier? And then we kind of focus our goals on what is important to each family. Every day I'm learning something new, I'm meeting new people, I'm learning about the newest diagnoses and treatments. I also love that I get to be a part of these kids' recovery kind of from day one. When we're in the ICU, after a kid has come in from a car accident or some other trauma, and I get to be the one to help that child sit up in bed for the first time and hug their mom or dad. That's pretty cool.
I'm RHEA Weber, and I'm a physical therapist here at Children's Hospital and Medical Center. Physical therapists are really the experts in mobility, and our goal is to help our patients access their environment and do the activities that they want to do with as little help or as much independence as they can. So that might look like helping a baby learn to crawl or walk. It might be helping a toddler run and play after heart surgery, helping an athlete recover from an injury, or teaching a child how to use a wheelchair or a walker. Physical therapists often have a challenging job of getting kids moving when they're not feeling well, so some of the things we have to do are hard, but the fun part of our job here at Children's is that we get to do that through play. So we get to engage kids in doing the activities they love while also encouraging them to move, and while the things we do are hard sometimes, we get to laugh and have a lot of fun with kids too. Being a physical therapist is a very rewarding career. Like I said, there are challenges certainly, and helping people move can be hard work, but there's nothing like seeing your patient be able to get up out of bed and take their first steps after an accident or an illness. And it's so rewarding to see the smiles on kids' faces when they're able to play and do the things that they love to do.
My name is KAYLA Brown. I'm a speech-language pathologist here at Children's. I work primarily on the med-surg floors and also in our PICU. Speech-language pathologists work with people of all ages. We work with the tiny little babies over in the NICU up until our more adult-like patients. A speech-language pathologist works with people on communication and swallowing problems. Some of our patients might have difficulties with articulation, phonological disorders, or apraxia of speech. So a speech therapist would provide the direct instruction to help these patients clearly enunciate their words. Another area that a speech therapist might work with is language. So language disorders occur when a person has trouble understanding others, so that would be the receptive language or the information that's coming through your ears, or an expressive language impairment is when they're having difficulty clearly and concisely gathering their thoughts to express their wants and needs. Our feeding and swallowing team is made up of speech therapist and occupational therapist, and they work together with babies from our tiny little babies over in the NICU to our adult patients as well. And they are just working on helping them successfully suck, swallow, chew, just in as safe as a manner as possible, and hopefully provide a lifelong joy in eating. Being a speech therapist is so rewarding. We really get to see the progress that these patients are making and improving their lives, whether it's communication-based or feeding-based, just knowing that these interventions that we help with these patients are going to better their lives and their families' lives as they continue to grow.